Enter the room.
Hello, examiner. I am Dr. Berkay. My GMC number is 123. Hello, I am Dr. Berkay, one of the doctors in the GP today. Can I confirm your name, please?
Hi, doctor. My name is Damon Morgan.
Hello, Mr. Morgan. And you are here for your son, Elliot Morgan. Is that correct?
That's correct.
And can you confirm his age, please?
Yes, he's 3 years old, doctor.
All right. And Mr. Morgan, according to my notes, your son has a right side swelling and fever. Can you tell me more about it?
Yes, he has been really unwell for the past 5 days. I'm really worried about him.
Okay. And can you please tell me, you said 5 days, is that right?
That's correct, yeah.
Okay. And did you use any medications, any over-the-counters for fever?
Yes, I used paracetamol and it still doesn't go down. It's always, I measured it and it was around 38 degrees Celsius.
And does he have, is this fever always around 38, or did you read it more than it? Is it
Well,
always?
it's always been around that time. He's always been running a fever, and whenever we try reading it, it's not coming down. I don't understand. These medications usually work, right?
Yeah. And does he have any other symptoms than fever and this swelling?
Well, he's got this rash. I think it's a rash. It's on his body. I mean, it's a little worrying. I'm not sure what he has.
And did it also start 5 days ago?
Yes, around that. I mean, it started like 2 to 3 days ago.
3 days ago. Okay. And do you remember where did it start? It start on the tummy or around the face?
Yes, it was on his tummy first, and then it started to spread. And now it kind of spread. It's. I think it's affecting his hands as well. You know, I don't know how it can affect the hands like that. I'm not sure.
All right. And is there anything else you realized apart from these symptoms?
I don't know, doctor. Like what?
Okay. Like, for example, do you feel peeling of the skin around the fingers?
Yes. Yeah, it is starting to peel. That's there. Yes.
And do you think about this rash? I'm going to ask a little bit about this rash. Do you think, does it have different shapes? Does it have different patterns, or does it look alike?
I would say everywhere it goes, it's looking different, but it is spreading.
Okay, I see. And what about Elliot's general health? Does he have a condition before? Is there any medical condition you want to mention?
Not really. He's been absolutely a healthy child. I don't know how this happened all of a sudden.
And apart from this disease, is he on any medication? I'm just trying to be sure. No?
No medications.
No. Okay, great. And what about his, his birth? Is everything okay? Did he have any specific condition during the pregnancy?
No, doctor. Nothing like that. He had a perfectly normal birth.
Okay, great. And can I ask you, Mr. Morgan, what might be the cause of this condition?
I'm not sure. I'm really worried. I don't know how this happened.
Okay.
You actually asked me. I think he had met his cousin a few weeks back who was suffering from chicken pox. I mean, he's never had chicken pox, but I'm not sure. Is it chickenpox? It doesn't really look like that.
Well, we are going to assess from head to toe. Then I'm going to talk to you about this. And anyone in your position would feel the same, would feel this, would share these concerns. You are totally right. And is there anything which worries you the most? Which worries you the most? Is there anything?
I've never seen anything like this, doctor. I'm actually
Mhm.
worried. I mean, is it something serious?
Yeah. First of all, we are in good hands. We are going to do our best for Elliot. All right. So from now on, I want to examine Elliot. I want to check his rashes. I want to check his body. Okay.
2 minutes remaining.
Okay. Okay. Thank you so much. And I also want to have some laboratory tests, run some diagnostic tests as full blood count, CRP, and ECG.
They are all awaited.
Okay, thank you. And Mr. Morgan, according to my assessments, he's been having a condition called Kawasaki disease. Have you ever heard about it?
No, not really. What is it? Is it something dangerous?
Well, this is a condition which we need to follow carefully. Because you are here, you are at the hospital, everything is under control. Now I am going to admit you first of all, and we are going to give some medication to lower his fever, and we are going to also we may also need to give some steroids to control his condition. In this condition, a virus or another disease may cause the body to produce some defensive particles, and this may cause different reactions in the body. All right. Do you have any questions so far?
I mean, doctor, will he be all right? Can you treat him? I mean, apart from the steroids, it's
Move on to the next station.
all
Thank you.
right. Okay, thank you very much. So that was very good. Your data gathering was pretty good, I would
Thank
say.
you so much.
But unfortunately, you didn't have much time for management. That's not a good thing. Because
Yeah.
see, no matter how much time you spend for data gathering, you still have to cover management. You have 8 minutes, and there are 4 marks allotted to management. Quite frankly, you didn't really manage to say anything in management, right? Because you told
Yeah.
me Kawasaki disease, but you have to elaborate on what it is. That's very important, right? So, I'll just take you through the case. So, this is the tool that I was mentioning before. So this really helps in organizing your consultations. So the main thing that I would say is remember that as soon as at what time did you manage to get that it was Kawasaki's?
Mhm,
How
mhm.
long into the consultation did you manage to understand that it was Kawasaki's when you asked about the hand, right?
Well, I was thinking about scarlet fever and Kawasaki, and
Right?
you mentioned swollen hands. It was a bit close to scarlet fever actually, but also you
Mm.
mentioned the fever is not going down; it is persisting. So I decided to go on Kawasaki, and you mentioned feeling of the fingers.
And these formations, right? So that's correct. So there is polypoid rash is what happens in Kawasaki, and in scarlet fever you have something called like sandpaper rash, pinhead, and that also starts on the trunk and goes all over the body. That's true. And there are in scarlet fever, if I'm not mistaken, you will have Forsheimers spots. So you
Yep.
will have sorts of throat, right? So that is also an important clue there. But I would say that once you were clear about what it was, I think I'm not sure if the hands get involved as much in the scarlet fever, because these formation I think is a little classic for Kawasaki's. But scarlet fever is an infection. Kawasaki is mostly like an immune reaction. So it's
Yeah.
your body which is reacting to some kind of exposure to some antigen. So after that, it's like a hypersensitivity reaction, basically, right? So in this case, basically the main thing is that this child is in GP surgery, and you have to send it to emergency.
Yeah.
So the examiner will come and give you a few more points. I just want to tell you some main points over here. So you have to take them to emergency surgery. So in GP, they have very limited resources, so that you can only do enough to manage the case. But if it gets complicated, you can't do anything. So this has a chance of getting complicated, because one of the complications in Kawasaki's disease is coronary aneurysms.
Yeah.
And there are chances that it can get worse. And
Mhm.
so two main things you're supposed to give is IVIG and high dose aspirin. And
Right.
when you're giving a child a high dose aspirin, you're supposed to monitor them very closely. Children usually don't get aspirin.
Mhm, mhm.
So the mainstay would be to refer them to the ED in this case.
Okay.
Because always remember that if it's a case that can get complicated, refer them immediately. All
Okay.
right, because whatever you can manage in the ED, that's fine. That then you can handle it. But if it has a chance of getting complicated, make sure you refer them immediately.
Okay.
Right? The examiner will take over and he'll just take you through all the points.
Hi, doctor. That was your data gathering is on point. You asked all the important questions. You got the diagnosis, but there's a few things that will help you shorten your data gathering, and so that you can move on to your management faster. Because your management also carries equal amount of points, right? So you have 4 marks for data gathering and 4 marks for management. You have to give equal time for both. Otherwise, you're going to miss out on everything in your management, right? So we'll just show you how what are points that you missed and covered. All right. So your data gathering wise, so I'll just give you a general approach to data gathering in a case like this. So first thing is you ask about the presenting complaint. What is the presenting complaint? And before you ask the presenting complaint, think about what do you what information do you already have, right? So if you look at the question, it already mentions. So you already started with, you could have started with asking. I believe your child is having swelling and fever. So can you elaborate? Can you tell me a bit more about that? So that way, you're showing the examiner also that you have read the information that was given to you. So you always have to use the information that is there in the question also before you before you ask the questions. All right. So it's very important, because never miss out on the information that is already presented to you. All right. And after this, you have to start elaborating. So elaboration also always start by elaborating one by one. So presenting complaint, you did that well. You asked about fever first, and then you asked about the rash. But you have to ask about swelling as well. So
Yeah.
one of the other one of the important differentiators between scarlet fever and Kawasaki's is also the lymph node swelling. Where is the swelling? So if it's both sides, it's bilaterally, it's more likely to be scarlets, and if it's unilateral, it's more likely to be Kawasaki. That's also an important differentiator. So, but that's okay. There's not enough time to go into all that. But once you get the hand foot swelling, that's when you'll know that it's Kawasaki's, right? But
Mhm.
how do you do that? You need to rule out more dangerous differentials. So any child presenting with fever, what is the most dangerous differential that you have to rule out?
Leukemia. Yeah.
Any even more critical, even more dangerous, immediately life-threatening?
Mm.
Meningitis. So
Yeah.
always
Yeah.
think
Yeah.
about always think about that. Always rule out meningitis first. If there is fever, always rule out meningitis first. So just ask a few questions about ruling out meningitis first. Like as soon as you have your presenting complaint, elaboration of presenting complaint, and immediately go into differentials. First
Okay.
major differentials would be to differentiate between Scarlet and Kawasaki. Once that is done, immediate next differential you need to rule out is the worst possible scenario. So always think about it in that. Any patient you see, always think about what's the worst that can happen to this patient. All
So
right.
Yeah.
we have on it where we have the 3 C's. So the one thing is that as soon as you get your diagnosis, try to get to management fast. But before you get to management, make sure you rule out the 3 C's. The first one is critical, the second one is cancer, and the third one is common. So think about what could be the most critical. Ask one question around it, like shyness to light, does he have any neck stiffness? And then you can ask about leukemia, family history, does anybody have any blood disorders, right? And then finally, one in this case, the most commonly related one would be the scarlet fever. And since there was a kind of contact with somebody with, chicken pox,
Yeah.
that's something to throw you off, right? But then you're still on, you know what it is. But that was good that you knew what the case was, even though there was a distractor there. That's good. And then come back to management immediately because you don't have much time because you've shown the examiner that you're a safe doctor by
Okay.
ruling out the most critical ones. Because critical
Okay.
ones you have to ask one or two questions around them, and then once you get your diagnosis, it's good if you get it as soon as possible. But as soon as you get your diagnosis, move on. Go on to examination and then go on to management. But in examination, try to mention the examinations that you want to do, like general physical examination, vitals, ASR, CRP. Because unless you mention it, they will not give you those findings.
Yeah, and another important thing here is the tongue. So to get the image of the tongue, you have to mention oral examination here. Otherwise, they wouldn't actually hand you the picture of the tongue as well. So make sure
Mhm.
you're very specific about the examinations. Always mention. So you can't just say general physical examination. You also have to mention the oral
Specific
yeah,
ones.
oral examination of rash you mentioned, but you know what finding you're looking for, so always mention the specific examination as well.
Okay.
And
And in some cases, you will also be getting the investigations. In this case, it was awaited. But sometimes to give you like a better idea, sometimes you will get the differentiator when it comes to the investigations. So mention the investigations if you think those would differentiate it from other conditions, right? So then they will actually give you the investigations as well. Or sometimes you might just say that, it's awaited.
so after your differential diagnosis, there are a few more questions that you have to cover in data gathering always. So here you covered birth history, that was birth and pregnancy history, that was good. But always think about social aspect as well. Psychosocial aspect is very important, especially in pediatrics. How is he who is taking care of him at home? Is he going to be okay after they leave from your consultation room? So always just ask a few things about how who takes care of him. Is everything okay at home? Because that's very important because that is something that you have to provide in your management as well. Because they might be completely dependent. They might be they might require a lot of other support as well, social support as well. Because you can't just tell them to go immediately to the hospital without actually finding out are they even able to do they even have a vehicle to go, or do we need to provide an ambulance for them to go from there, or are they can they actually afford childcare once they leave the hospital afterwards? So these are very important points. So just to cover all these, you just have to ask who takes care of it who takes care of him at home, and is everything all right at home? So these are very important questions that you have to ask. Other than this, family history and feeding, drinking habits are also important to ask, but it's all right. We can miss those because if you don't have enough time. But as soon as you know that you've covered all these points, try to move on to the management immediately because you have a lot more in the management to do. And before you do the management, always try. You did ideas, concerns, expectations. You just did ideas alone, but try to do the concerns and expectations also. It doesn't really take much time for you to do those. So always ask what are you expecting from this consultation, and what are your main concerns right now. So it's just one sentence. You can just finish that. So because that is something that the patient, the simulator already always has it in their information, not to answer for ideas, concerns, and expectations. So they're definitely looking for that question. So that is something that you have to ask. You can ask that either in data gathering or in your management, but make sure you involve that.
And this is a very important question because sometimes the cases might be a little concealed. You know, a patient might be coming for a rheumatoid arthritis medication review, but actually they are expecting you to give medication for their insomnia. So if you ask the concerns and expectations like that, then they'll actually reveal, you know, what was their real purpose of coming.
And other than that, then the examination and your diagnosis. So now in management, so you explain the diagnosis, and just try to explain what the diagnosis is. You did that well. That's not bad. And one thing is always try to know where you are. So right now in this is in the GP surgery. You said you're in the hospital, so it's entirely different. GP surgery is just a clinic. There are no facilities to take care of acute emergencies there. So you always keep that in mind because that shows the examiner that you didn't read the question properly. If you don't pay attention to that, that's very important. So always, whenever you're reading your candidate info, always see who the patient is, where you are also. That's very important. All right, because that tells you what your management is going to be. So here you have to tell them that they have to go to the emergency department right away because this is an emergency. Okay? And management wise, it's IVIG and aspirin and supportive care as well because the child is having fever. So fever is something that needs to be treated, and especially at this age, they are prone to having febrile seizures as well, right? So a child who is having fever immediately needs to be treated for the fever first before you send them away. So tell them that I'll give you something for the fever. I'll give you some paracetamol for the fever, and you mentioned some cooling measures also. You can tell and continue, fluids and any discomfort that the child might have. If the child is in pain, or also the paracetamol will help.
So this condition is basically resistant to paracetamol. So no matter, even giving paracetamol, it was there in the stem as well that, after giving paracetamol, the fever didn't come down. That's again classic when it comes to Kawasaki. So then you have to try other cooling measures, like tepid sponging, or, just mentioning more cooling measures that you can use by the time you go to the hospital, right? So that the fever doesn't cause any, doesn't worsen and cause any other side effects.
All right. And another thing in management is, there's a lot of things to cover in management, especially when you don't have enough time. What you have to do is, whenever you hear the 2-minute bell, always think about 3 things in your management. That is follow-up, safety netting, leaflets, and pamphlets. All right. These 3 points are very important in your management because they at least cover 0.5 or 1 mark each. Because even if you don't mention the correct diagnosis, even if you don't mention the right management, you will still gain some points by covering these 3 things, because you're showing the examiner that you're a safe doctor by doing these 3 things, which are follow up. Basically, once they leave your consultation room, you don't know what is going to happen to them because they won't be able to come back to you easily by themselves, right? You always have to set up a follow-up appointment for them. only then they'll be able to come and see you again. Otherwise, they won't be able to come and see you again. Otherwise, you won't know what's going to happen to them, right? So even if you do refer them somewhere else, always set up a follow-up appointment with them just to see how they're doing again, because you're their GP, you're their first point of contact they came to see you first, right? So always try to set up a follow-up appointment. That gives the patients confidence as well, all right? Because you're not just sending them away. That is one thing. And safety netting. So safety netting is very, very important, especially in pediatrics. Things can worsen very quickly because the child won't be able to express their problems, right? So always have to mention the signs that they have to look out for. So very most common warning signs in children, breathing difficulty. So that basically increased respiratory rate. So they won't be able to tell if there is breathing difficulty, right? So you have to tell them what that is. That is, if the child is breathing very fast,
Or they are grunting.
lethargy, grunting, and so these are the signs that you have to tell them always to look out for. And a general way to tell safety netting is if the symptoms are worsening. That's a very easy way to generally give a safety netting. If the symptoms are worsening, or if the child is breathing too fast or grunting, or if the child is lethargic, unable to eat or drink, always immediately go to the emergency department at any time. It's not just right now, even in the future also. That way they'll know what to look out for, what are the warning signs to look out for. So safety netting and leaflets and pamphlets. So leaflets and pamphlets is very easy to mention because it's always any case you can easily give that, because NHS has leaflets and pamphlets, patient information for everything. And they expect you to give it to them because you want the patients to be well informed, right? Otherwise, they won't know what is the right kind of information to look for. Otherwise, they probably will just Google things and they might find the wrong information. So you have to always guide them towards the right, credible sources of information, which are basically your leaflets and pamphlets, right? So always mention these three things, which is follow-up, safety netting, and leaflets and pamphlets, right, in your management. And your interpersonal skills are good, but you're rushing a little bit. You're very, what do you call, to the point. You're trying to cover everything. You're trying to ask all the questions, right? But you need to show a little bit of empathy. So try to include a few empathetic phrases once in a while. At least in the beginning of the consultation, where you before you start the consultation, you always try to say, "I can see that this is very tough situation right now. I can see that you're worried about his fever. I'm here to help you." That's enough. So that way, for your entire data gathering, at least you've shown some empathy, right? And signposting. Signposting is whenever you're moving from one type of questioning to another type of questioning, always give them a warning. A warning in the sense, tell them that, okay, I'm going to ask a few questions about his general health right now, and then continue. You don't have to ask them permission. You just have to mention it, and then you ask the next question. Right? That doesn't seem very robotic. That's very important because rapport is one of the points that they're looking for in your assessment. So that's very important. And you use layman terms to explain medical conditions, but you didn't really have enough time to actually explain what Kawasaki disease was in the simple words. But that's all right. It's expected here. But yeah, otherwise it's I think you're on the right track, but you need to manage your time way better than this, because just keep practicing. That only comes with practice. You need to develop an internal clock, right? You always need to know when the 4 minutes is going to end, because there's only a 2-minute warning bell, which is not enough time for your management. So that 2-minute bell is only there to tell you to wrap up your station, not to move on to your management, right? That's not well for, because you need to 4 minutes for your management. All right. Make sure you try to understand when 4 minutes is going to happen, right? That you'll only understand by doing practice. Just keep practicing every day. Right now you have 2 weeks or slightly more than 2 weeks, right? So every day, at least 5 cases you have to practice, right? I'm saying at least. So, you have to practice way more than that because you're, nearing your exam. Because that's the only way you're going to understand how much time has passed. Because every time you ask a question, you'll know how much time you have spent without even trying to think about how much time is going on. That only comes with practice, right? But yeah, other than that, it's very good. You're on the right track. Just keep practicing. You'll do really well.
Thank you so much. Bless you. Thank you so much.
Thank you so much. All right, everybody. This was our mock for today, and we'll see you next week. Good luck, Dr. Ahmed.
Thank you so much again.
All right. Bye-bye.
Bye bye.
You. All the best.
All the best.
Please like and subscribe to TuringMedSchool. Good luck with your preparation.